Hi, I'm Dr. Sanjit Konda, Chairman of the Department of Orthopedics for Medicis Health Network. I'm here to talk to you today about a problem that goes very underdiagnosed in most of our patients, but something that we deal with on a very regular basis. And this is the idea of bone health. Now, as a chairman of the Department of Orthopedics, one of the things I see very regularly is fractures. Now, there are over 6 million fractures treated in the U.S. every year. Every person in the U.S. can expect to have up to 2 fractures in their lifetime. There are 2 fractures in particular that are very, very detrimental and very devastating to patients. One is a hip fracture and the other is a spine fracture. Now, there are over 1.5 million spine fractures per year in the U.S. and over 300,000 hip fractures per year in the U.S. These are all things that may be preventable. And I'm here to talk to you today a little bit about some of the things that we do here in the Department of Orthopedics and some things that the primary medical doctors here at Medicis also take care of, which is your bone health. Now, when you have a fracture, or even before you have a fracture, it's important to ask your doctor about things that you can be doing in order to strengthen your bones. Now, one of the things that we always say is taking calcium and vitamin D supplements. Now, whether you're getting that through your diet or through just general exercise, being out in the sun, all of these things can contribute to your bone health. When you go to the doctor, some of the things that we may do is we may test for your calcium and vitamin D levels. If you are deficient in the calcium and vitamin D, we may recommend you take supplements. Oftentimes there are tests that we can send you to, something called a DEXA scan. We provide that service here at the Medicis Health Network. A DEXA scan can check for your level of osteoporosis. That's how weak your bone is. If you have weak bone, getting to the level of osteoporosis, we may recommend certain medications. Sometimes it's a medication that you take daily. Sometimes it's a medication you take once a week, and that can help strengthen your bone over the course of many years. These are all things that we encourage you to ask your physician about, especially your orthopedic surgeon, if you have an opportunity to see them. If there's ever a question, please feel free to reach out to the number provided here, and we'll be happy to set up an appointment for your bone health visit.